back over. I'm sorry. We already drew up the medicine, and you know that whenever somebody calls or anything happens on the phone, it shuts down Periscope. Well, that happens quite often, so sorry about that. We will get a couple of things here. Medicines and Guy Bauer's ethyl chloride. This is what freezes the skin so that it's not as painful. And then I need the actual single needle for the injection. Let's go to the room.
Okay.
So room is room 2. We have the stuff. So I'll put my tools here, and then Jessica will show you. We already have the camera going. We're already on
Okay.
Periscope is what it's called.
Did you consent to show your face?
Yes, I did.
Okay.
Yeah, people always want to know, did the patient give consent?
Yeah.
Yeah, just hold that there. And I'm finding the point here just below the prominence where my finger just, there it is. So I'm going to go in here, and my other finger is going to go here, and I'll go point the needle right toward this point.
Okay.
So I'm putting a circle around it. I don't use Dr. Gawain's technique either of not using ink. So we'll do a big wide swath on that. If you're holding that, I can go ahead and do the prep.
Okay.
Yeah, did you want to tell them anything about how this started, or?
When you're old, don't move a lot of paint. Big buckets.
Don't move a lot of heavy paint.
Exactly.
All right.
Yeah, I told her not to, but she did anyway.
We're a team, remember?
Yeah, we're a couple old mules, and one does something, the other one has to do it.
Oh,
Coming up on 50 years, I guess.
50 years of,
Yeah.
50 years of hurting each other together.
Yeah,
Yes. Share the load.
share the hurt.
So we're going to use some iodine on a swab stick to.
Iodine?
Oh, you can't have
I
iodine.
can't have iodine.
That is correct. We will not use iodine.
Don't break out.
We'll use Hibiclens. And the Hibiclens, I need to get some sterile. Do we have any sterile gauze in the rooms?
Oh, I just
Here it is.
cleaned some. There you go.
There it is. Okay. Thank you. All right. So
Yeah, she's the one that knows. I love iodine.
he loves iodine. He has it with.
Poured all over me.
He has it with his pancakes.
I think
Well,
it's
that's
great.
pretty.
Is that what they're saying?
No, I'm
Oh,
saying
okay.
that.
All right. So notice I'm just using the part that's sterile to.
Mhm.
But you can't see it. That's why I don't like it as much as the iodine.
Or it goes on clear then.
Well, fairly clear. Yeah. I'm sorry. Am I keeping you guys from seeing what's going on because the way the position?
How's
Oh,
this?
yeah. Thank you.
Perfect. Now this is usually my job, but now my job description is hold the phone.
Now look back over your shoulder with a sultry look.
We told her sultry. That's usually I did something wrong.
You guys. All right. So I'll get over here so you can come around this side, and we're going to spray this on. And what we're going to see is the skin turn white. This is cold, by the way, but this helps it not to hurt as much.
Oh, good.
All right, it's starting to turn white. Don't want to do it too long because causing frostbite isn't good. In this case, we
I
do
agree
on
with
purpose
that.
when we freeze skin lesions. All right, so I put my thumb there, my forefinger here. My thumb is cold. All right, draw back to make sure there's not anything that shouldn't be there, and then give some medicine. And then you're not screaming or kicking. No? Do you feel it? You do feel it. Okay. How bad is it? It is
Pretty
bad.
bad.
Okay.
She's pretty tough. If she's making that face, it's hurt.
It is hurt. Okay, let's get done as quickly as we can then.
Yeah, she's pretty tough.
Okay, that's the whole
Okay.
procedure.
You there.
So this is the part of it where we have you move your arm around and see how it feels moving after compared to before.
Somebody says, poor thing.
I can go up.
Yeah? How's that?
Oh wow, look
I
at
haven't
that.
been able to do
Yeah.
that.
Like I told you.
For a
Praise
long
God.
time.
That's what better to me. I think it's just wonderful.
I
that
could do
stuff.
that.
Oh wow.
Oh, yeah.
And you weren't able to lift it up at all.
No, I couldn't go up like this. If I had to get something off the second shelf, either he had to get it or I had to use my left hand. And big bowls aren't safe to use with one hand, especially the weak one.
Wow.
Oh,
right,
that
good.
is great.
Okay, now I have to tell you what to expect because the anesthetic that works right away and numbs it up wears off within about 5 hours.
Okay.
So it's going to be sore this weekend. It'll be
Okay.
just like it was before. You won't be able to get the big bowls this weekend. But the cortisone kicks in anywhere from 2 days to as long as over a week. So gradually you're going to get back to where you are now.
So just don't
Next week.
overdo it
Yeah.
and expect it to take
Expect it to
time.
hurt tonight.
Okay.
Yeah. All right.
Yeah.
Okay.
That's perfect.
We'll step out while you get dressed, and I'll finish with the how much motion she regained so fast.
Yeah.
Yeah,
Yeah.
it's a cool procedure. It really is. You know, as bad as steroids are and all the bad side effects they do to people, it's a miracle drug too at the same time.
It is good.
All right, thanks,
Thank
guys.
you.
Thanks for participating.
Thank you.
All right, we'll see you next time. Thanks, Jessica. So another injection, and as you see, it is very rewarding to be a doctor because you can do things that instantly make people feel better after they've been hurting for, as she said, 3 months. It is the coolest thing. So any of you guys are pre-medical students or medical students who are inspired by that, know that medicine has those moments, and it is rewarding. It's refreshing for me to have, to see that happen. So it's one of the reasons I like procedures so much. Family medicine, primary care, it's not as procedure intensive as a lot of the other specialties, subspecialties, but you do get to do things like that, and it's with people you have a relationship with. We've known each other for over a decade, and we go way back. It's very rewarding. Somebody asked, how long does this last? If it gets the inflammation down so that the injury is no longer a problem because the swollen part of the tendon isn't hitting up against bone anymore, then it's good until she re-injures it, re-aggravates it. It's kind of a permanent solution for many people with this problem that don't ever have it come back. And then they may injure it again and it'll come back. So thanks for watching. If you don't already follow, swipe right to follow and share with your friends. And you can also follow on Twitter if you want, @Dr. Vaughan. And we do have Medically Speaking Radio tomorrow morning at 10 a.m., but you can only find it at medicallyspeakingradio.com. And it's live, and we're going to have another Periscope doctor, Dr. Flock, the bariatric surgeon from Connecticut, Fairfield County, Connecticut, will be with us. We'll speak about bariatric surgery and obesity. So again, that's medicallyspeakingradio.com, 10 a.m. Pacific, and we appreciate you guys. So we'll talk to you next time. Until next time, this is Dr. Vaughan telling you to stay in good health.